Since the onset of the COVID-19 pandemic, digital solutions, including mobile health apps, patient portals, and telehealth, serve as a critical access point for healthcare providers to reach patients. However, many individuals have not been able to benefit from these digital solutions. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. In this podcast, Julia Resnick, Director of AHA Strategic Initiatives, is joined by Priya Bathija, Vice President of AHA Strategic Initiatives, and Sarah Swank, Counsel at Nixon Peabody. Priya and Sarah will discuss their upcoming article on digital health equity in a special edition of the American Health Law Association Journal of Health and Life Sciences Law. Here, they discuss barriers to access digital solutions and the role of healthcare leaders, including attorneys, in improving digital health equity.
Thank you, Priya and Sarah, so much for joining me today to talk about digital health equity, which is such an important topic. So for starters, what is digital health equity? Sarah, let's hear from you first.
Thank you for having me today. A good place to start with digital health equity is understanding health equity. When we look at health equity, we often are looking at outcomes-based and data. And one thing to think about when you're looking at that data is you'll see things like shortened life expectancy or outcomes that affect life or death. And you also hear words like disparities, which are differences. And then you have to take that definition and apply it to the digital world. And what does that mean? It means that we know that technology plays such a vital part in our healthcare right now, and that how it's used or not used, how it's developed, will actually impact health outcomes. So when we're discussing these topics, we're even hearing people call it a super determinant of health, something that's really going to impact your health outcomes. And as we see that virtual care becomes such a critical part of how we receive healthcare, it's really going to be a divide between the haves and have-nots. And it's going to create probably likely measurable differences in people's healthcare. And it is trying to ensure that there is equity within the digital space to make sure that those differences are not there.
Priya, anything you want to add to that?
Thanks, Julia. I'd just like to add that I look at digital health equity in sort of two buckets. The first is lack of access to technology that is necessary to use digital solutions. And the second area is digital health literacy, or the ability to understand and fully utilize the benefits of digital health solutions. And as Sarah mentioned, digital health equity has been considered a social determinant of health, or to some, a super determinant of health. And I think it's important to acknowledge that both access to technology and digital health literacy are societal factors that influence the health of individuals and communities. And lack of access to technology can have significant health consequences. So for example, FCC data shows that in areas with lower broadband connectivity, residents have higher rates of obesity, diabetes, unnecessary hospitalizations, and sick days. And in addition, the lack of access to broadband and other technology can impact other factors that influence health. So that includes the ability to apply for jobs, get housing, or apply for other assistance programs that are increasingly available only online. All of the areas of our lives these days have become so tied to technology and digital solutions. And we saw that firsthand throughout the pandemic. So now those without broadband don't have the same access to food, education, economic stability, and even the ability to just engage with others that are in their community. So at the AHA, Julia, as you know, we have set forth a framework that explains how societal factors of health can be addressed at the individual, community, and systemic levels. So when we're looking at digital health equity, it's important to look at all three of those levels, right? So how can we address this as a social need and improve access and literacy for individual patients? How can we address this for the community as a social determinant of health? and what underlying or systemic issues need to be addressed to improve outcomes in the long term.
Thanks, Priya. That was a really great overview. So I'm curious, we're going to stick with you. What are some of the current barriers that individuals are facing related to digital solutions?
So the first thing I think most people jump to when they think of the barriers here is broadband access. And that's a very real thing. At the end of 2019, the FCC estimated that 14.5 million Americans lacked access to fixed broadband service at threshold speeds. And if you look at those that don't have broadband at the threshold speeds needed to support digital solutions, that number is even higher. I recently saw a report from Microsoft that estimated that 157.3 million Americans don't use the internet at broadband speeds. And it goes beyond just broadband infrastructure. Even in places where broadband may be available, there are millions of families that can't afford it. We know from the US Census Bureau that 13.9% of urban households and 19.2% of rural households don't have a broadband subscription. So this is a national issue across our country. And we know from a variety of data and research that racial and ethnic minorities, people who live on tribal lands, older adults, and people with lower levels of education are less likely to have broadband at home. And then outside of broadband, there are other barriers to access, one of which is having the technology needed to operate solutions. So many individuals still don't own smartphones, and without the right technology, these individuals can't take advantage of mobile health apps or patient portals or health services offered through telemedicine. And the last barrier I want to touch on is one that we don't talk about as often, but it's equally as important. And that's digital health literacy, or the ability to use, process, and understand technology. So, for example, most digital health tools are available in English only, or they're written at high reading levels. So those that don't speak English or can't read at a high level would struggle to use these tools. Individuals can also face cultural barriers or a lack of training or knowledge needed to use these solutions.
So, Sarah, improving digital health equity implicates a number of legal considerations, which you and Priya discuss in the article. Can you describe what some of those considerations are?
Yeah, I'd be happy to, Julia. And just to piggyback off of what Priya said, it's not, when we talk about the law, it's not just about barriers, like the law's getting in the way. These are all real opportunities to improve healthcare and health equity. So when we talk about the law, we should think about it in that framework. I think, first is to think about redefining what access means, right? We're in a digital age, and we can look at discrimination and access claims. And when we think about those laws, they were brick and mortar laws. They were like, how do I access the building? But now with virtual care being so integrated into care delivery, it's something more than that now. Like Priya said, it could be like, how do I click a button so that I can get in? Maybe this button's not accessible. Maybe the language that I need is not there. And so it's really imperative that we go back, look at those laws, look at the technology, and start doing access reviews and audits to look at how people are accessing the technology that we're rolling out. You can look at things like wait times, you can collect data, you can even look at recruiting people into your clinician workforce that reflect your community, so that even when you go on to a telehealth appointment, for example, that someone might reflect your community. These are important things to look at. The other thing is the fraud and abuse laws. So when we think about the federal fraud and abuse laws, we think a lot of times the first thing that comes to mind as a barrier is like the ability to give out technology or to have access to technology. And we've seen a change in the fraud and abuse laws, the anti-kickback statute and other laws that are allowing more freedom for hospitals and others to provide technology in a way that is still compliant. They still need to be reviewed and looked at, but it's nice to see that we're seeing changes in those areas of the law. I think also what we're seeing is the concept of equity getting baked into payment reform and value-based care, and the idea of measuring this as a data set. I can remember when ACOs were new, and some people would say, well, these are unicorns. Like, we're never going to see an ACO lawyers and hospitals are never really going to have to, compliance professionals are never really going to have to think about quality measures. Like, why would we even need to think about those? But we saw them roll out and they became a real thing. And we know that there's Z codes and other codes out there that can measure different social determinants of health. And we're seeing right now, even in the ACO REACH program, a look at quality measures that look at equity or equity measures themselves. And we're seeing proposed rules around it. So I think we're going to see some ability to have compliance and legal reviews of those. And last, what I would leave with is, we're looking at the OIG putting out information about reviews of telehealth programs and compliance. So it'll be interesting to see where that heads as well.
Thanks, Sarah. And we know hospitals and health systems are thinking about digital health equity and are taking a number of steps to improve their work in this space. So Priya, can you share some of what's happening there?
Sure, happy to, Julia. And I think it's really exciting to see the different ways that hospitals are taking this on. At a high level, we've seen a number of hospitals make an intentional commitment to designing and implementing strategies in a way that all patients can access and understand. So they've made digital health equity an intentional part of the conversation as they design solutions. They've also made digital health equity an intentional part of the implementation and evaluation stages of a digital solution. So it's not just one and done. They're regularly looking at data and evaluating who's actually accessing and using these solutions as they're implemented. And then they're making modifications as they go. In terms of improving digital health access, we're seeing some hospitals provide technology to patients and physicians, of course, in compliance with many of the laws that Sarah just referenced. We're also seeing hospitals proactively select solutions that minimize barriers to access. So those are solutions that operate off of cell towers instead of requiring Wi-Fi, or they're looking at solutions that rely on text-based communication. In addition, there's a huge advocacy component to work around digital health equity. So we're seeing healthcare providers and even technology companies advocate for policies that allow individuals to access these solutions and then strengthen the healthcare providers' ability and capacity to provide these solutions. And so we're seeing that happen on the local, state, and national level. And of course, AHA has been advocating for investments in infrastructure and increased federal funding, coverage, and reimbursement for the expanded use of telehealth and new technologies. And last, I just want to say, hospitals are also working to improve digital health literacy. So we're seeing a lot of partnerships between hospitals and technology companies to design solutions that actually take into account what patients and communities need. So they're engaging diverse communities in the design, implementation, and evaluation process. They're asking patients what they actually want. They're addressing things from a linguistically and culturally sensitive perspective. They're tailoring solutions to meet those that have lower digital literacy. So that includes using more emojis, more videos, more graphics. And then they're also providing training to individuals who may not trust or want to engage in these solutions or don't have the comfort level needed to engage. So those are just some examples, but the approaches that we're seeing being taken by hospitals are really different depending on the patients and the communities that they're serving. So I think the best starting point is to make that commitment to implement solutions in a way that addresses digital health equity, and then figure out how to build solutions that best support that hospital's patients and communities.
Thanks, Priya. I think this is a really pivotal time for digital health equity, so I'm so glad to have both of you here to have this conversation. As we wrap up, I'm wondering if either of you have any parting thoughts that you want to share with our listeners before we go.
I just want to thank Priya and Julia for having me here today to talk about this issue. I agree, Julia, this is a pivotal time. I've heard someone say, like, the cement's going to dry. We need to start writing the history on digital health equity now. And I appreciate the more we talk about it, I think the more change we'll see. So thank you.
Wonderful. Well, thank you both.